If you take blood pressure medication, you have almost certainly heard some version of this. Those pills are going to ruin your kidneys if you keep taking them long-term. Or perhaps you have thought to yourself that, since your blood pressure seems fine lately, it might be a good time to quietly stop. Both of these ideas are dangerously wrong, and today, this video is going to show you exactly why with the data to back every claim. Start with this statistic about the scale of the problem. Among Korean adults over the age of 20, approximately 1 in 3 has hypertension. Yet research suggests that among those patients, only about 50% receive a diagnosis, only half of those begin treatment, and only half of those who begin treatment maintain it consistently. This means the vast majority of people with high blood pressure are walking around with uncontrolled vascular pressure, doing silent damage every single hour of every day. One of the major reasons people avoid or abandon treatment is the persistent belief that blood pressure medication destroys the kidneys. The truth is the precise opposite. Uncontrolled high blood pressure is one of the most destructive forces a kidney can face. Inside each kidney sit approximately 1 million microscopic filtering units called glomeruli. These tiny vascular structures are exquisitely sensitive to pressure. When systolic blood pressure remains chronically elevated, it forces blood through these fragile filters at excessive pressure, gradually scarring and destroying them just as water hammer destroys old pipes. Once damaged, glomeruli cannot fully filter waste from the blood, and protein begins leaking into the urine. Left unchecked, this progression leads to chronic kidney disease, and eventually end-stage renal failure requiring dialysis or transplantation. A nationally tracked Korean clinical study following chronic kidney disease patients for approximately 5 years produced a clear quantitative finding. Patients with systolic blood pressure above 140 mm of mercury faced a risk of kidney function deterioration that was 1.82 times higher than those with systolic pressure below 120. The rate at which kidney function declined was also twice as fast in the high-pressure group. A separate analysis found that even blood pressure, held in the 130 to 139 range, elevated chronic kidney disease risk by 1.6 times, while levels above 140 pushed that risk to 2.5 times. Compared to normal blood pressure, it is uncontrolled hypertension, not blood pressure medication, that destroys kidneys. Now consider what the most commonly prescribed blood pressure medications actually do to the kidneys. Two widely used classes of antihypertensives, known respectively as ACE inhibitors and ARBs, do not simply lower blood pressure. They actively protect kidney tissue. These medications relax the outflow vessel of the kidney's filtration units directly, reducing the internal glomerular pressure that causes structural damage. In large-scale clinical studies, patients on these drug classes experienced reductions in urinary protein loss of more than 50% from baseline, and their rate of kidney function decline slowed by approximately 23%. For hypertensive patients with diabetes, this kidney protective effect is even more pronounced. The correct conclusion is therefore that a well-chosen blood pressure medication extends the functional lifespan of the kidneys, rather than shortening it. What happens when a person stops blood pressure medication without medical guidance? This is the most important section of today's video. It is not simply that blood pressure rises back to its previous level. Abrupt discontinuation, particularly of beta blockers and certain calcium channel blockers, can produce rebound hypertension, a state where blood pressure surges significantly above pre-treatment levels. This is classified as a medical emergency. The blood vessels, which had adapted to lower pressure over months or years, are suddenly exposed to a pressure spike they are not structurally prepared for. The risk of stroke, myocardial infarction, and aortic rupture rises acutely. The quantitative stakes of blood pressure control are clear. For every 5 mm of mercury reduction in systolic blood pressure, the risk of major cardiovascular disease events falls by 10%. A 10 mm of mercury reduction cuts cardiovascular disease risk by 20%, stroke risk by 27%, and coronary heart disease risk by 17%. Stopping medication and allowing blood pressure to rise by 10 mm of mercury or more means every one of those risk reductions is reversed, and if rebound hypertension drives pressure higher than the original pre-treatment baseline, the cumulative damage is even greater. After stopping medication, blood pressure can rebound within as little as 1 month, and the vascular exposure to elevated pressure during that window continues to accumulate damage. Does this mean blood pressure medication must be taken for life in every case? The answer depends on the individual. If hypertension is caused by a secondary condition such as kidney disease or an endocrine disorder, treating the root cause can normalize blood pressure and allow medication to be reduced. Sustained lifestyle changes, meaningful weight loss, sodium restriction, regular aerobic exercise, quitting smoking, and moderating alcohol can lower blood pressure enough in some patients that a physician may consider cautious dose reduction. Losing 1 kilogram of body weight produces an average reduction of 1 millimeter of mercury in systolic pressure. Regular aerobic exercise reduces systolic blood pressure by 4 to 9 millimeters of mercury. Restricting daily sodium to below 6 grams further contributes to blood pressure reduction. But every one of these adjustments must be made in active collaboration with a physician. Feeling well is not a medical reason to stop medication, because hypertension rarely produces symptoms until something catastrophic happens. 5 foods provide direct kidney and cardiovascular protection for people managing blood pressure. Blueberries contain anthocyanin antioxidants that protect kidney cells from oxidative damage. Critically for kidney patients, blueberries are also low in potassium, phosphorus, and sodium, making them safe across all stages of kidney disease. This combination of antioxidant potency and kidney-safe mineral profile makes them one of the most recommended foods for kidney health. Cauliflower provides indole compounds, vitamin C, and dietary fiber that reduce kidney cell inflammation. Alongside low potassium and phosphorus content, it supports the vascular filtration environment inside the kidney, without placing additional mineral burden on impaired kidneys. Olive oil contains oleic acid and polyphenols that reduce vascular inflammation inside the kidney's filtering structures and lower oxidative LDL cholesterol. Its phosphorus content is extremely low, making it the preferred cooking fat for kidney disease patients who must control phosphorus intake. Garlic provides allicin, which dilates renal blood vessels, lowers blood pressure through a supplementary mechanism, alongside medication, and inhibits oxidative damage to kidney tissue. It also allows food to be seasoned richly without added sodium, which is essential in a kidney-protective low-salt diet. Fatty fish, particularly salmon and mackerel, supply omega-3 fatty acids that suppress glomerular inflammation and slow the rate of kidney function decline. The blood pressure-lowering effect of omega-3 also reduces the physical pressure load on kidney tissue. Note that for patients with significantly reduced kidney function, total protein intake must be individually managed under medical supervision, so the appropriate quantity of fish should be confirmed with a healthcare provider. One final critical safety message: everything in this video is preventive health information and does not replace medical care. Never reduce or stop blood pressure medication without consulting your doctor. Abrupt withdrawal of beta blockers in particular can trigger a hypertensive crisis that is a life-threatening emergency. If you already have kidney disease at any stage, your safe intake of potassium, phosphorus, and protein must be individually managed by your healthcare team. Foods high in potassium, such as avocado and banana, may be harmful for those with impaired kidney function, even though they support cardiovascular health and others. Individual responses to every dietary and lifestyle change vary significantly. If you have concerns about your current medication or kidney function, the most important step you can take is to bring today's information to your next medical appointment and have a direct conversation with your physician about what is right for you specifically. The medication is not destroying your kidneys. The uncontrolled pressure is. That one fact, understood clearly, may be the most important thing you take away from this video today.